temporal bone. It's quite a complicated bone. To see its full extent, we'll again remove the mandible. The temporal bone goes from here on the outside to here underneath. This is the petrous part of the temporal bone. This is the squamous part. A prominent feature of the temporal bone is this large projection, the mastoid process. As we'll see, it's the origin of some of the muscles that move the head, including the sternocleidomastoid. It's easy to feel the mastoid process here, behind and below the ear. There are the frontal and zygomatic bones, the maxilla, the sphenoid bone, and the ethmoid bone. The frontal bone is a very large bone. The lower part of the frontal bone forms the beginning of the root of the nose, the upper part of the orbital margin, a small part of the temporal fossa, and a large part of the roof of the orbit. The frontal bone also forms most of the floor of the anterior cranial fossa. The part of the frontal bone near the midline is hollow. The hollow space is the frontal sinus, one of the paranasal sinuses, which we'll look at shortly. Next, we'll look at the zygomatic bone. The zygomatic bone forms the bony prominence of the cheek. It also forms the lower lateral part of the orbital margin and this part of the lateral orbital wall. The zygomatic bone extends backward to meet the zygomatic process of the temporal bone, forming the zygomatic arch. Now we'll move forward and look at the maxilla. Here's the maxilla. The right and left maxillae are joined together in the midline. On each side, the maxilla forms the lower medial part of the orbital margin and almost all of the floor of the orbit. The maxilla bears the upper teeth. On the underside, it forms much of the hard palate. The maxilla is hollow. It contains the largest of the paranasal sinuses, the maxillary sinus. To see the posterior part of the maxilla, we'll remove the zygomatic arch. Here's the back of the hollow part of the maxilla. Down here, the maxilla is joined to the bone behind it, the sphenoid bone. Apart from this attachment, the maxilla is separated from the sphenoid by this impressive cleft, which has a vertical part and a horizontal part. The vertical part of the cleft is called the pterygomaxillary fissure. The horizontal part of the cleft is called the inferior orbital fissure. The inferior orbital fissure, here it is from in front, separates the floor of the orbit, formed by the maxilla, from the lateral wall that's formed by the sphenoid. The part of the maxilla that bears the teeth is called the alveolar process. We'll look at the teeth later in this section. The alveolar process ends behind at the tuber. Now we'll bring the mandible into the picture. The mandible develops from two originally separate bones, one on each side, which fuse together here at the symphysis. The mandible is described as consisting of the body and the right and left ramus. The corner between the ramus and the body is the angle of the mandible. The rounded projection that articulates with the temporal bone is the condyle, or condylar process. The narrowing below the condyle is the neck. The sharp, slender projection in front of the condyle is the coronoid process, a major muscle attachment, as we'll see. The dip between the coronoid process and the condyle is the mandibular notch. The angle of the mandible is roughened on the outside and on the inside by the insertions of a matching pair of muscles, the medial pterygoid on the inside and the masseter on the outside, which we'll see shortly. The body of the mandible is described as consisting of the base and the alveolar process. The side of the body slopes upward and inward, slightly on the outer aspect, markedly on the inner aspect. The posterior part of the alveolar process bulges medially above this hollow, the submandibular fossa. This projection in the midline is the mental protuberance. On the inside, this roughened area is the mental spine. Two pairs of muscles are attached here, the geniohyoid and genioglossus muscles. On the inner aspect of the mandible, this thickening below the coronoid process is the buttress. In the middle of the ramus, level with the tops of the teeth, is the mandibular foramen. Just in front of it is a small upward projection, the lingula. The mandibular foramen is the start of a tunnel for the inferior alveolar nerve and blood vessels. A major branch of the nerve emerges on the outside at the mental foramen.